running clotting profiles. Take one.
So in order to run a clotting profile for the doctors, you're going to want to first post the clotting profile that you want to run. In this case, we're running an APTT clotting profile. We're going to want to post that to the patient's medical history from the estimate. By doing that, that's going to create a requisition in Avamark and send all of the patient info to the vet lab station, and it'll put it in the pending slot here. So in this case, we're running a profile on Miniton Olson. In order to run the profile, we'll select Miniton, and that'll allow us to either delete or run the profile, and we're going to want to select Run. That has all the patient's information already for us, the doctor that we're running the profile for, and we're going to want to select down here at the bottom the COAG DX. In the event that we're also going to run a PT in addition to the APTT, we would select this again. Doing so will show a green and a yellow COAG box underneath the patient name. What that means is that you're going to run one first, and then you'll have to select it again on the next screen to run the second profile. So now that we have both those there, we'll go over to the top right-hand side of the screen and select Run. Now you can see at the bottom that we have two COAGs pending, one waiting to be run, one ready to be run. If you look on the COAG screen here, the patient ID, the patient name, and the species is there, and it's asking us to insert the cartridge. When you remove the cartridge from its packet, there's going to be a little well on the right-hand side of the cartridge. The well should remain on the outside of the right-hand side of the COAG machine. So you'll notice this little black slot here. That's where you're going to put your COAG slide. Once that gets inserted here, it'll start warming it'll warm the cartridge and tell you when it's ready for a sample. When you add the sample to the well, you only want to add 2 to 2.5 drops of your sample, making just the small enough bubble like you would with a fecal for the sample, and then you'll press the start button. Once you press the start button, the sample will start to go into the machine, and it'll start running the sample for you. If there's too much sample, the machine will tell you, and you'll have to start over with a new cassette. If there's not enough sample, the machine will tell you, and you'll have to start over with a new cassette. And that's how you run a COAG on the vet test.